All right, let's jump right in. We are smack in the middle of two gigantic, world changing forces hitting us at the exact same time. First, you've got artificial intelligence, which is completely tearing up the old playbook on how we create new medicines. And on the other hand, you have this huge new wave of regulation trying to write the rules for this incredible technology while the paint is still wet. Today, we're going to look at what happens when this unstoppable force meets this immovable object. To really get why this all matters, you have to start with this number. It is just mind-blowing. $2.8 billion. That's the average cost to get one single new drug from a lab into your local pharmacy. It is one of the most expensive and riskiest things a company can possibly do. And it's not just the sticker shock, right? It's the clock. The timeline is just as daunting. We're talking about more than 15 years from that first aha moment in a lab to a pill that can actually help someone. For so many patients, that means the cure they need is always just a little too far in the future. So, to see how AI is just completely changing the game, we first have to understand the old way of doing things. Let's take a quick walk through that traditional drug discovery pipeline and see, where all that time and money actually goes. Man, it is a long and winding road. It all starts with finding a target. Think of a specific protein that's causing trouble in a disease. Then, scientists have to screen thousands, sometimes millions of different chemical compounds just to find one that has any effect. That's called a hit. From there, they pick the most promising one, the lead compound, and try to make it even better. And only then, after all that, does it go into years of testing on animals and then humans before, if you're lucky, it finally gets approved. It's like a giant funnel where almost everything fails. And this is where AI enters the chat. But it's not just making things a little faster. It's completely rewriting the rules of the game. AI is bringing a level of speed and, maybe more importantly, precision that was just unimaginable before. So think back to that old process, right? 15 plus years, a decade and a half of work, mountains of cash, and just an unbelievably high chance that it all ends in failure. Now look at this, 18 months. This is the new reality. In a now famous case, a company called In Silico Medicine used its AI platform to do the whole shebang, find a new target for a disease, design a brand new drug from scratch, and get it ready for human trials in just a year and a half. What used to take a decade now takes less time than it takes to finish high school. This isn't science fiction anymore. So how on earth is this even possible? Well, the key thing to understand is that AI isn't just a super fast search engine. It's a creative partner. It uses these amazing techniques like generative adversarial networks, or GANs, to literally invent new drug molecules that have never existed before. The best way to think about it is like having two AIs. One AI, the generator, is like a brilliant but wild artist, just churning out thousands of new molecular designs. The other AI, the discriminator, is like a tough critic that instantly says, nope, that won't work, or, that one has potential. They go back and forth millions of times until they land on something a human might never have even dreamed of. And here's the proof in the pudding. It's not just about being faster, it's about being better. Historically, a little over half of all drugs make it through those first early human trials. But with drugs that were designed by AI, that success rate skyrockets to between 80 and 90%. That means way less failure, way less wasted money, and a much, much better chance of getting these miracle drugs to the people who desperately need them. But you knew there was a but coming, right? This incredible, world-changing power comes with its own set of absolutely massive challenges. We have to wrestle with huge ethical questions, figure out data privacy, and face the fact that our old rules were just not built for a world with technology this powerful. And this is where our whole story pivots. Because of all these challenges, the world's regulators are now stepping in big time. And leading the charge is Europe. They've just passed the world's first ever comprehensive, legally binding law for artificial intelligence. They are trying to build the guardrails for this revolution as it's happening. This new rulebook is called the AI Act, and its goal is huge: to create one single set of rules for how AI is built and used across the entire EU. It's all about trying to find that sweet spot between encouraging all this amazing innovation and, at the same time, protecting people's safety and fundamental rights. So at its heart, the AI Act is all about risk. It doesn't treat every AI the same. Instead, it creates this kind of risk pyramid.
At the very top, you have systems with unacceptable risk, and those are just banned outright. Think social scoring by governments. Below that, you have high risk, which has to follow a ton of really strict rules. Then you have limited risk stuff, which mostly just needs to be transparent. And at the bottom, minimal risk AI has basically no new rules at all.
So here's the million-dollar question. Where do our revolutionary drug discovery AIs fit into this pyramid? Well, it's probably no surprise. Almost anything AI related in medicine, from helping doctors diagnose diseases to creating brand new drugs, is going to fall squarely into that high risk category. And that means they're going to face the toughest, most stringent rules in the entire law. Okay, so what actually happens when this incredible medical revolution slams into this landmark regulation? What do these new rules really mean for the scientists and the companies that are on the absolute cutting edge of this stuff? Let's break it down. First off, the Act creates two main roles. You've got the provider, which is the company that actually builds the AI tool. They're the ones with the most responsibility. Then you have the deployer. That's the hospital or the research lab that actually uses the AI. And they have responsibilities too, like making sure there's always a human in the loop. Now, for those AI providers in the high-risk category, the to-do list is long. They have to prove their systems are accurate and safe. They have to design them so a human can step in and take over at any time. They have to keep incredibly detailed technical documents. It's like a black box flight recorder for the AI, so regulators can see exactly how it makes decisions. They even have to register their AI in a public EU database. It is a whole new world of oversight. And don't think this is some far-off, distant future problem. This timeline shows that these rules are coming online fast. The really critical date for us is August 2026. That is when all of these tough new rules for high-risk systems, including medical AI, officially go into effect. The clock is definitely ticking. And all of this brings us right to the heart of the whole thing. The future of medicine is now this incredibly delicate balancing act. On one side, you have the desperate, urgent need for faster, cheaper, and better drugs, all powered by AI. And on the other, you have the equally urgent need to make sure this powerful new technology is safe, fair, and trustworthy. And that leaves us with the ultimate question, doesn't it? We have a technology that can shrink a 15-year marathon into an 18-month sprint, potentially saving millions of lives. And at the same exact time, we are building this essential regulatory wall to prevent it from causing harm. So the real question for all of us is this: can we have both? Can we really have world-changing innovation and careful, robust regulation at the speed that our health and our lives demand? The answer is going to define the next chapter of medicine.